My name is Holly Mitchell. I am a junior at the Kingsport campus for King College, and I'm involved in the nursing program there. The topic that I'm discussing today is mixing law and ethics, a lethal combination, and it is concerned with participations of physicians in executions. Even though physicians' participation in execution is in direct violation of the fundamental directives of the governing medical ethic bodies, it is a necessary practice to ensure a good death for the convicted. Due to the influence of English common law, executions have been employed by the United States of America since its inception. Primitive forms of execution exercised in the United States include being pressed to death, drawn and quartered, burned at the stake, and the guillotine, a device used to behead the convicted person. In 1792, the guillotine was fueled by Dr. Joseph Guillotine, who proposed to the English government that the death penalty should be imposed on the guilty who had committed crimes punishable by execution, regardless of social rank, and that such punishment should be carried out in a swift action to eliminate undue suffering. The government quickly adopted this idea and was commissioned to build the guillotine device. In 1891, Dr. Albert Southworth, a dentist, happened to witness a drunken man inadvertently come into contact with the terminals of an electric generator. Dr. Southworth, witnessing this quick death for the unfortunate man, judged electrocution could be a less cruel form of punishment. Relaying this information to a senator in the government, the senator introduced legislation to the New York body, hence passing its use in 1887. Lethal injection as a means of execution was approved in 1977 in the United States. As lethal injection grew in popularity among the states and the federal government, the need for skilled medical providers to assist and perform such punishment grew. Legislation then recognized the need for qualified medical knowledge to perform such practices as the lethal injection and passed laws mandating physicians to be present at every execution. For the involved physicians, this meant it was in direct opposition of the ethical codes, such as the Hippocratic Oath that had been taken by physicians for centuries to protect the people they treat. The AMA stance on this is they strictly prohibit physicians' participation in any legal authorized executions. Unauthorized involvement includes prescribing or administering the medications to perform lethal injection, monitoring the vital signs, selecting or maintaining the IV sites in which the medicines will be delivered, and attending the executions in the capacity of a doctor. They believe that participation in execution will erode the public's confidence in the medical profession. But they do approve acceptable involvement includes testifying at capital trials, certifying their death, and relieving the suffering of the condemned person who is awaiting trial. The physician's argument. Ironically, physicians participate in the court order executions with motivations that resemble many of the qualities that make up the code of ethics they are defending. They want to provide medical care and respect the law. Understanding the position of the governing bodies as well as the laws is important, but just as important is the process itself. Knowledge of the process is the foundation for forming an opinion on the necessity of educated, experienced medical personnel's participation in executions. Once the convicted has exhausted every avenue to have the execution overturned, they ultimately find themselves in a room in which they are to die. Most states have set timelines of these events, and eerily, one knows where and nearly the exact minute that they are going to die. Those present in the room are the prison warden, guard, spiritual advisors, and medical personnel. Witnesses can view the execution through a window. Potentially, witnesses include relatives of the victims, media representatives, and selected officials. Once in the room, the curtains are drawn to temporarily prevent witnesses viewing preparations that are made. The convicted is then placed on a gurney and restrained using the exact same techniques used on the medical surgical floor in the hospital. They are hooked to an EKG to monitor for the time of death. 2 intravenous lines are placed by medical personnel, 1 in each arm. Saline solution is hung, and the flow of lethal injection to ensure flow of lethal injection into the convicted veins. While in the past many states have utilized mechanical systems for this administration of lethal medications, many states have opted out of such practice due to the potential of mechanical error and have chosen to use hands-on medical personnel. In this setting, the medical personnel are known as the execution team. In carefully measured doses, contents of the lethal injection is therapeutic to patients in a hospital setting. They include sodium, muscle relaxants, and electrolytes. In executions, these medications are given in doses of up to 500 times the therapeutic dose. Skills, knowledge, and experience involved in executions by lethal injection. These skills include portal vein access, ascertaining the necessary medications, proper administration of the prescribed medications, knowledge of how to read an electrocardiogram, the ability to assess vital signs and the knowledge of the necessary requirements, and the ability to recognize the signs of the legal definition of death, and to carry out the execution in the professional and respect for human life under demanding circumstances. It's not about whether you're for or against the death penalty. It's about prevention of cruel and unusual punishment set forth in the 8th Amendment of the United States Constitution, using skills, knowledge, and expertise of trained medical professionals to ensure a good death. Those for and against physician and medical personnel participation in capital punishment have very passionate arguments, but until legislation revokes this sanction of this practice, it will continue to be part of our society. When taking into account the depth of knowledge that is necessary to carry out an execution, it is absolutely necessary to have qualified, educated, and experienced facilitators in order to perpetuate this good death.